Okay, I know you clicked here and you really want to throw away your inhaler. Don't do it yet. Okay, wait until we have our talk. Okay? Hi, this is Michael Berglund and welcome to Common Sense Medicine. Today we're talking about asthma. Specifically, can an asthmatic throw away their inhaler? The answer is yes. Now the depends is how asthmatic, what are your triggers, what are you sensitive to? I knew it, I knew there was a catch. Keep watching. You might actually get some benefit to this. So the idea here with asthma is obviously a breathing problem. And since you clicked on this video, you know that. You know that what happens is your windpipe shrinks down, so breathing is like breathing through a little straw, right? It's like trying to get enough air into your lungs for the oxygen that you need to actually survive. So you're like, doesn't feel like you can get enough air in. That constriction is the problem. And the steroid is an anti-inflammatory. The steroid, when we talk about steroids, we're talking about specifically corticosteroids, which is actually cortisol, which is actually an adrenal hormone designed to actually help us when we're in cases of stress. Is that why I get kind of a little shaky after I have my emergency inhaler? Exactly. You breathe in the inhaler, it goes in, it's anti-inflammatory, it's fast-working anti-inflammatory, especially for the emergency inhaler. There's a long-term one for the daily inhaler, right? But then it's anti-inflammatory, so it opens up the airway, done. We're talking about steroids. Now, one of the examples of steroids is prednisone, right? Prednisone is also in this class of steroids, all right? So when people, and when quarterbacks, blow a shoulder, they go, can I get a shot, doc? Can I get a shot? I need to go in for the game. They're asking for a shot of steroid, not like steroids like those guys on steroids, because that's testosterone steroid. But this guy's getting a shot here as an anti-inflammatory steroid, okay? These corticosteroids are the most powerful anti-inflammatory that we have in our modern day culture. They're phenomenal, and they wreak havoc sometimes because here's the thing, that guy, they used to in the 70s, they were giving these people shots and shots and shots, and what they eventually found is this person's bones would start to demineralize. They found that the people's tendons were just popping. That corticosteroid had put their system in a sympathetic versus a parasympathetic mode. Parasympathetic is the body's own natural, everything we're maintaining, we're fixing, we're the daily operations of the human body. Sympathetic mode is fright, flight, fight. It's like there's a bear, there's a lion, there's a child in the street, there's someone with a gun to my head. It's an emergency situation. The body doesn't care about organ function, it doesn't care about bowel movements, it doesn't care about anything, it doesn't care about putting calcium on the bone or repairing or replacing anything. So all it cares about is providing enough blood for my brain to think and for my muscles to move. So steroids, adrenal steroids, when they inject it in, it creates, the body goes, oh, demineralizes the bone, causes poor healing. The body says, shut down the healing, we don't need to heal this area. Next thing you know, after chronically using steroids, things can just break and tear. So let's get back to the asthma. So the inhaler decreases the inflammation, therefore increasing the size of the trachea and the bronchioles and the respiratory passages here, increasing the oxygen to the areas where it needs to go. The problem is it also creates other issues. Now, steroids, corticosteroids specifically, actually reduce the immune system. One of the problems we have with asthmatics is they tend to have hyperimmunity. Let's say, oh, well, that's great that we've lowered the immune system. Right. But the problem is they're hyperimmune toward dust and mold and cat dander and dog and pollen, right? And so the issue here is that they've spent all their efforts fighting these little inert substances, things that aren't going to bother them, things that can't hurt them, and then they neglect the obvious ones, which is the virus, right? Which is the cancer. And we don't want to do that because those things will kill us. Those things can take us out. Dust won't take us out. But their body, the asthmatic body, generally doesn't understand that. They don't get that. The classic stuff with asthma we're dealing with, when I see them on a natural level, all right, what I try to do, the first thing we want to do, since I can't control the air they breathe, I can try and control the food they eat. if there's like a funnel in the body for inflammation for allergies, okay? If there's too much stuff going in, it accumulates, and there's 5 spigots flowing into this funnel. The allergies, the histamine, the different responses will magnify. If I can't control maybe the dust, I can't control the dog, but maybe I control wheat, maybe I control milk, maybe I control a few of these other things. Maybe if I reduce sugar, the sugar doesn't cause a dysfunction in the immune system, and basically then the body can actually kind of purge itself of some of these allergens, and the asthmatic reaction will go down. Then I usually have people take like things that are antihistamine. And I just think, oh yeah, I take Benadryl. Benadryl has a lot of fatigue issues. And then Claret and Zyrtec, they work for some people, they don't work for other people. Okay? I just try to have people take their vitamin C level and increase it. Now some people are going, oh yeah, I'm taking like 2,000 milligrams of vitamin C. If you're allergenic, if you tend to have asthma issues, if you had problems in this area, you are going to go through 8, 9, 10, 15, 20,000 milligrams of vitamin C a day. A lot of vitamin C. So the idea is that at those levels, it acts as a decongestant and an antihistamine, therefore reducing the congestion and reducing the histamine load. Okay? So sometimes those things are in powder, sometimes they're in buffered form, which means they have minerals instead of ascorbic acid. But you generally do a ascorbate flush. You increase the amount every day until you get diarrhea. Once you get diarrhea, that means your body can't handle anymore, and then you cut back from there. Usually, if you're doing this, you want to use 1,000 milligram capsules of ascorbic acid. If the acid starts bothering your gut or starts causing canker sores, then you might want to go to buffered vitamin C, which has calcium, magnesium, potassium in addition to the vitamin C. And then you're looking for loose stools. As soon as you get the loose stools, you cut back from there, and that's your dose. But then you should notice a reduced amount of need for the inhaler, and a reduced amount of reactions, congestion, just postnasal drip, all that stuff. Should be less. The other thing we notice with people that have asthma problems is they tend to be low adrenal. If we boost the adrenals, they tend to be more balanced, be able to handle more things, and their immune system tends to be better. The last one is magnesium. Now magnesium is beneficial. Now if you're doing this the mineral ascorbates, magnesium should be in the mineral ascorbates, and that's great. If you're not, usually would be the minimum. 600 milligrams of magnesium would be the minimum. You could go up to like 1,000 or 1,200. Here's the thing. Once you get too much magnesium, the same reaction, you're going to have diarrhea. Okay? I don't want you to have diarrhea, so you're going to cut back from there, and that should be about where your body can handle the magnesium dose. Implementing these things, just on a generic basis, should help control some of your asthma reactions and may reduce or eliminate the asthma medication that you're on and even your inhalers. This is Dr. Michael Berglund. This is Common Sense Medicine. You've been watching Asthma.